First up is our director panel. This is titled Honoring the Dignity of Veterans by Working Together. So, good mental health clinicians know that working with your client uh, and their treatment team is absolutely critical to an individual's mental health treatment and recovery. And most of us who practice have seen far more progress when you've got a good, strong relationship. As a matter of fact, there's an old adage that says that the therapeutic relationship or the relationship between the therapist or clinician or social worker is the most important determinant of success in a clinical setting for the client. So it's really important. The leadership on this panel believe the same thing is true of larger systems that provide mental health services. So this year we set about to really reinforce and expand the collaboration with a Be Connected MOU and some new requirements that Access has established. So we're excited about those things. Next slide, please. First, the MOU. The MOU is between VISN 22, which is kind of the regional entity within the VA. Each of the VA health centers, the VBA, state agencies, and the ACMF to ensure that Be Connected reaches really far into the community and deep into each organization. That they have POCs to support collaborative efforts like this summit is a really good example of that. Support positive referrals that cover all social determinants of health from all possible organizations that are vetted and doing really good work, and to actively collaborate with each other to plan for the future. Next slide, please. The second major breakthrough is in Access, or Arizona's Medicaid system. We established an approved Access established an approved statewide veteran resource provider. This means that more service members, veterans, and their families will be connected to more resources, services, and benefits than ever before. Access was one of the original members of Be Connected, but this is going to like a whole nother level. And we are, as I've been saying, probably like 50 times, I think you can hear the excitement and the repetition. We're pumped about it. So having the managed care organizations and more providers who are working with Be Connected in our networking events, who are receiving training in military culture and clinical best practices, who are disseminating coordinated information about the VA and non-VA resources, and who are making more referrals for the myriad of social determinants of health that create barriers to service delivery and satisfaction is going a long way to ensuring that no one is left behind. So let's get to it. Okay, today we have a group of people who are like beautiful English wainscoting. I mean, they are great as a panel and very classy. All right, please join me in welcoming Jennifer Gutowski, Director of Southern Arizona VA Healthcare System. I believe we have Steve Sample, Director of Northern Arizona VA Healthcare System. You guys can pop on your screens. Dr. Leslie Lockridge, she is working to try to be able to get here. There's been some things over at the hospital that she's working on, but she's working to come over with us. Dana Almond, the CEO or cabinet level executive officer for the Arizona Department of Veterans Services, welcome. And Marcus Johnson, the Deputy Director of Community Engagement and Regulatory Affairs for Access, which is Arizona Healthcare Cost Containment System, or Arizona's Medicaid system. All right, welcome all. So let's start. Do we have Steve?
Yes, I'm here, Thomas.
Awesome, thanks, Steve. Okay, so next slide, if we would, so you can see what the question is. So, Steve, would you mind kind of just first of all introducing yourself and telling us why you think this type of high-level collaboration is important to mental health?
Sure. I'm Steve Sample. I'm the Executive Director at Northern Arizona VA. So I've been up here. I moved up here in 21 and took over permanently in this role a little over a year ago. I'm a 23-year Air Force veteran, served during the Gulf War and also during the Kosovo engagement. I think, part of what drove me to this, and I've been involved in this even when I was down in Tucson, so I think I've put up with Thomas's bad dad jokes for 10 years. And I thought his theme song would really be HR Puff and stuff from the back in the day, but I guess not. So the choice today was better. So, the high level collaboration is really, really important. And, as a veteran, I think all of us know people that have had struggles and issues, and our ability to work between the VAs in Phoenix and in Tucson and in Northern Arizona. It's really about serving veterans. And, we could focus just on our area, but our veterans travel back and forth, and we rely upon veterans to get services through the VA, and we encourage veterans to get services through the VA. So that high level collaboration, from my perspective, is really important, that we have a great partnership. So we're very fortunate. We have a wonderful relationship that we built over the years working with Phoenix and working with Tucson. And I think a lot of that, and I've mentioned this before, is really based upon the work with Be Connected and the coalition that is done. Our partnership also with the Arizona Department of Veteran Services and VBA kind of is a complete package when we look at federal and state. But it's also important to have that high level collaboration with our community partners, because again, there's not one thing that we could do individually. We have to work as a team. And so I think that that's really been beneficial. And I think that's really the value of these partnerships. And we really have to demonstrate that from the top. So thank you, Thomas.
Hey, thanks, Steve. Really appreciate it. Okay, Ms. Kutowski, Jennifer, from Southern Arizona, would you mind introducing yourself and telling us a little bit about why you think this high-level collaboration is important?
Happy to, and good morning, everyone. Again, Jennifer Kutowski. I'm the Director CEO for the Southern Arizona VA Healthcare System. Just reflecting upon my career, I've had a chance to serve veterans for 24 years, so really honored. And my call to the mission is that my dad is a Vietnam veteran, served as a Navy corpsman, and lives with me and my family full time. So and he gets all of his care from the VA, from this VA. So it's really important to me, the work that we do, and that's what drives me every day. I just in reflecting upon, why the high level collaboration is so important. And, I just think about what we're doing today and watching all those resources come on the screen in the beginning. Behind each of those slides are a Verizon network of folks, right, of people, and we're all people taking care of people. And so, I think it's part of my job to demystify the VA and to let everyone know that we're people behind it. And I think what was said by one of those veterans, we want to see veterans thrive. And this partnership, because the VA can't do it alone, is so important because there are some things that we can't do. But when we work together, it is amazing what we can do and see our veterans thrive. So I'm just really appreciative to Be Connected and to everyone that is on this summit today and coming together, make these connections, get to know one another, because this is how it all happens. And I'm getting chicken skin saying that, but it is how it all happens, just creating that network to serve our veterans. So thank you, Thomas.
Hey, thank you, Jennifer. Yeah, great points across the board. And, I always love the whole chicken skin thing as opposed to goosebumps because he didn't have any gooses. All right. Hey, Dr. Leslie Lockridge, thank you so much. We're so happy you're able to join us. And so I guess the if you didn't catch it, it's just a simple introduction of yourself, and then kind of talking about why this high level collaboration type of stuff, especially where we're getting into the MOU and the access, deeper engagement, that type of stuff. Why is that important to mental health?
Yeah, so first, thanks for having me. I'm stepping in this morning for our medical center director, Mr. Brian Matthews, but I'm Leslie Lockridge. I'm the associate director for patient care services and also the chief nursing officer in Phoenix. Thrilled to be here. As I, I can echo the things that both Mr. Sample and Ms. Gutowski mentioned, but what we're really thinking about is, our end game here is to prevent suicide. And I think the reality here is that, over 95% of the time, we were talking about it the other day, those who die by suicide have a diagnosable psychiatric condition. And the most effective way at preventing these deaths by suicide is to ensure that we meet their needs. And so this is so important. These collaborations and relationships are so important. Because we really cannot do it alone, as others have mentioned, and it takes this working across organizations and in the coordination thereof to appropriately meet our veterans' needs. And so, just from an organizational standpoint, we have got to work together. We've got to be strong and communicate and leverage every last thing that we have. So we firmly believe in what we're doing here in this collaboration. Thank you.
Thanks, Leslie. Really appreciate it. All right, Mr. Marcus Johnson, going to pitch it over to you. And
Sure.
if you wouldn't mind introducing yourself and talking a little bit about responding to that question, that'd be wonderful.
Happy to. And Thomas, I, for one, am in full favor of you continuing with your dad jokes. It has been one of the best parts of my morning thus far, so count me in. Thanks for having
Hear
us
that, team?
I'm here in our CEO's stead, Ms. Carmen Heredia. She couldn't be here this morning, but sends her regrets and appreciation for this great partnership. I'm Marcus Johnson. I'm Deputy Director of Community Engagement and Regulatory Affairs here at AXIS. I have a background in public health and healthcare and a real passion in tying systems together in order to benefit individuals and families and communities. And I think this resource is exactly that. We definitely have a challenge where there are not enough resources out there, but we also have a challenge where there is an inequitable distribution of those resources. People are not able to understand where those resources are, how to access them. And often the people that are most trusted by those individuals, i.e. their healthcare practitioners or social service workers, they might not know how to get connected to those resources. And that's exactly what Be Connected does. It ties together, this is still very much a patchwork of a healthcare system and social service system, but Be Connected in this partnership really helps to tie those patches closer together to really reduce gaps and eliminate some of those silos. And so that's why we're so excited to be a part of this. And we at AXIS, along with our managed care plans, the private health plans that we partner so closely with, we know that we can do more in order to help to tie those resources together to make sure that when members are in front of a healthcare provider or in front of the VA or any other sort of provider, that they know that there's a trusted resource and Be Connected that can get them connected to resources. So we are thrilled to be a part of this larger collaboration.
I love that. Thank you, Marcus. I really appreciate the thing that you added to this, which was the concept of the patchwork. It really is rather confusing to operate amongst all the different levels as a person seeking out. We hear that all the time, and it's not for lack of trying and not for lack for effort, but there is a patchwork quilt aspect to things. I think on average, and in Arizona, I think this holds true, about 70% of the veterans are not receiving services through the VA. Obviously, we want to increase that number because there's great care at the VA. But the other piece is that the folks that are service members, veterans, and their families that fall under Medicaid, they're struggling in a variety of different ways. Because if you understand how Medicaid works, you have to be of a certain income level and those types of things. So those are oftentimes our targeted individuals that we want to work with and we want to be able to support more and provide more resources to, especially in all of the social determinants of health. So we're really excited to have AXIS advancing in this way. So we appreciate everything that y'all are doing. All right. So we also have Miss Dina Almond. Colonel, would you just do a quick introduction? And
Hi, good morning, everybody. It's a pleasure to be here as we're talking about something so important, and we work on this every day. So I'm Dana Allman. I'm a retired Army Lieutenant Colonel, 1994 West Point graduate, and I've had 4 commands throughout my more than 23 years of active duty Army service, and taken a lot of pride in all the teams over my years of working together, just like we are right now. I've had a combat deployment during OEF Philippines with Joint Special Operations Task Force Philippines. So I know what it's like to deploy and what goes on before and after you deploy. It's been a great pleasure as the Cabinet Executive Officer for the Arizona Department of Veterans Services, leading this, organization of professionals. Just a little bit more briefly, as I've been working grassroots, and I've been thinking about this for a while, because folks ask me about, you're now in charge of the state agency and your balance with grassroots. I've been grassroots my whole life, my whole career. So I love to use those principles of getting on the ground and figuring out how people are doing. And I do have an undergraduate degree in individual psychology, a master's in counseling and leader development. And what was so nice having that while I was on active duty is I could use those modalities in real time in the field with my people. And some of the motivations for me, I've been working on this for 13 years to figure out how to prevent death by suicide, deliberately thinking through how to get that done. I was the chief of well-being programs in Hawaii under U.S. Army Pacific. And I developed this love-hate relationship with emails because unfortunately, too many days in a row, I would get emails that said, we just lost another soldier to suicide. And my team is trying to figure out what to do. And so this high level of collaboration, I had wished I had this when I was on active duty. You try your best, but not everybody understands. Our folks in this space, we understand. And now we can proactively leverage all of our unique abilities by organization to create and maintain access to resources that support the 10 social determinants of health. So I'm just grateful that everybody's works together. And specifically, I've noticed that we're always in crisis mode. We want to be proactive. We are working on that diligently to capture and wrap our arms around those who are transitioning within the military when they transition out of the military. But we're suffering from burnout, fatigue, and trauma ourselves. And so we want our folks to thrive and serve for a lifetime, and we've also got to take care of each other. So that's why I love this collaboration. We're able to take care of each other while we're taking care of our veteran and military communities.
Hey, great points. Thanks, Dana. Yeah, I like the concept is your role in command. Yes, the part of what we've been very excited about is introducing deeper levels of engagement with our state's active and out of state active duty military bases. We've already, been connected with the National Guard and that type of stuff, but the active duty bases now are starting to, take on a more robust engagement with Be Connected as well, which is also really encouraging because then we've got the flow right between active duty service all the way through retirement. So, all right, that's great. Folks, usually I throw a couple of sliders in here. There's one coming up. For my next question, I'm going to go a little bit off book and I'm going to introduce a little bit of a controversial topic in today's society. If we can maybe advance to the next slide. So fluffy puppies and kittens, are they good or are they bad? Okay, who's gonna take the first shot at this? Anybody?
Are they potty trained?
Okay, that's a good question. Yes, they are the first puppies and kittens that have been genetically potty trained from birth. It's amazing.
Then they're good.
Puppies and kittens are always good.
Okay, so we have two goods. Anybody else?
Okay, and in my house, my kids out, everybody outnumbers me. There's like 6 people total in our home because my husband and my triplets and my oldest. So with the animals coming into the house, like the first one was the dog from, was it 2013? And I'm like, okay, I guess I'm overruled. Well, recently we have a cat for the past couple of years, Violet. So of course, I know it's on video now, so now it's going to be captured. I guess I'll just come clean. Yeah, the little cat is cute. In our home, Violet comes in, but you know how cats are, they have an attitude. But when what I noticed is when you flash this on the screen, I perked up. I don't know what that was about, but I got excited.
So Nicola, my spouse and coworker, colleague, she went to a presentation in Florida, and it was about military clinical practice and all that kind of stuff, and veteran mental health practice. And the presenter didn't have a single slide with any words on it. He just had different slides with puppies and kittens and that type of stuff. And his point was people are going to remember this where they may not remember the words. So I'll just throw this up as, whether you think they're good or bad, these are puppies and kittens, sworn enemies that are collaborating and working together. So if they can do it, we're way ahead of them. All right.
They should present this slide to Congress more often, I feel like.
Here. We support that. All right. Thanks for the fun, folks. Okay, so next slide. So in this question, really, and this is our kind of final question. I'd just be really interested in hearing your thoughts. Our theme today, as Ali said, was dignity. And so, talk to us a little bit about, how do collaborations, how does this type of communication that we're having now, how does that promote the dignity and mental health that service members and veterans and their families need in order to be able to even take that first, sometimes scary step to engage? And happy to start. Marcus, would you lead us off?
Sir, I'd be happy to. When I think about dignity, I think about what does a community, a family, a society value? And I think part of the hope here in this collaboration is that we are modeling the behavior and the values that we hope to see in others, in other individuals, in other communities, and in other organizations. Being able to show that mental health, behavioral health, the challenges that we all have, they're shared challenges. Sometimes they're more acute than in other times, and some individuals have it more frequently than others, but we all share in these issues and these challenges. And we as a community, as a state, are coming together to ensure that this really is, that mental health and behavioral health, that it's embedded within an ecosystem, that it's not the responsibility of just the VA or of just Axis or just some other state agency or organization, that we are all working collectively to tackle these challenges. And so hopefully, again, like this models the behavior that we hope to see in other organizations as well.
Yeah, that's awesome. Thanks, Marcus. Really appreciate your thoughts here. All right. Jennifer, what do you think?
Yeah, thank you. This is, in reflecting on it, I think about dignity and mental health. I think what speaks to me as we do greater collaboration is really meeting people where they're at, is so important, and providing personalized care. And I think when we do collaboration, that opens up that whole world of resources that are out there. And again, meeting people with where they're at, one of the things I'll just share about us here at the Southern Arizona VA is that I'm really excited. In January, we're receiving a mobile medical unit that is going to give us some ability to go out to our veterans that are homeless and be able to see them where they are and where they're at. And we all know that taking care and coming together to help house our veterans is definitely a community effort. And we're just one piece of it, but I think it's important that we're meeting them where they're at and being able to, again, I think give them the resources that make sense for them as an individual. And that, I think, really speaks to that dignity piece in providing mental health care. So thank you for giving me the opportunity to share that.
Yeah, thank you, Jennifer. I really appreciate that. Meeting people where they're at. I think a lot of the early conversations when we were first starting, especially around post-traumatic stress disorders, is people don't necessarily, meeting people where they're at. They don't want the diagnosis of PTSD. They want to be able to go to sleep. They want to be able to have a good night's sleep. They want to not have intrusive memories and thoughts. They want to, all that other stuff. So when we're connecting with them, it's about where they're at. And I love the whole mobile medical unit. That is really cool. We'll have to get some pictures of that. Yay. All right. Leslie.
Hey there. So, yeah, kind of reflecting on this too. And, I think unequivocally, all veterans are worthy of our honor and respect, which is really, if you think about the definition of the word dignity, that's it. And so, we have to remember why we value them. And, we value them because of the sacrifice that they made. And so, I was looking at some statistics, and only about 6.2% I was reading of the U.S. population served in the military. And so, we have to remember that, and that, we have to really think about how best to serve that 6.2% of the population. And it's really, for us, we have to think about how to get out there at that individual level, and we have to use these collaborations to, communicate, outreach, innovate, use those mobile medical units, all of these other things to absolutely meet people where they're at. And so, when I think about dignity and mental health, it's what do we need to do to get at that 6.2%? And, what do we need to leverage to get there? And we need to do it. We owe that to those individuals.
That's fantastic. And thanks. Yeah. There was a big, lots of folks were talking about the 1%, right? With the folks serving, and that got confused with the 6.2 or, percent. It's 1% serving at any one time, but then you've got the other folks who have served. So thanks for bringing that piece in there as well. And yes, dignity is respect for the individual. All right. Miss Dana?
Yeah, I've been thinking about this aspect here. I focused throughout my career on, treating each other with dignity and respect, and that's not going to end. And thinking about it now that as a veteran, and I'm going around the state and meeting with different veterans, like we've said, where they are. Folks really get excited when we come out and meet them and sit down with them and find out what they need. And sharing your own experiences, because I've thought about it. Jeff Davis meant a lot to me. I'd worked with him on preventing suicide for 4 years, and losing another friend who was struggling, and thinking about why did it take me so long to share my own struggles. And when you share that with the folks out here that are counting on us, because they need hope, and we all know that hope is not a plan, not a strategy. We get them fired up and knowing that we are here for them, and then they haven't lost a purpose. We took an oath, and understanding that your oath didn't expire, and we're here to help you to keep serving and thriving for a lifetime. So, those are the things of how to keep connecting. How do we keep doing that so that the veteran and military and their families, those communities, know that we care. I would say one day at a time, one person at a time, one event at a time, is to stay vigilant and showing that we care, and we're doing that together. So that's what I love with, the relationships I've had before I became the cabinet executive officer with the VA directors, and learning, working with them when I was the chair of the Southern Arizona Veterans Mental Health Advocacy Council, and now working with you, Thomas, and your team with ACMF. It's just been a pleasure going from grassroots of me to continue to do grassroots, but this exponentially, we could do so much more. And I just love it when veterans see that we care and they see the hope and that we're going to help them with a plan.
That's fantastic. Yep, you got to have all folks working towards the same end. And the beautiful thing is, in Arizona, we are. Thanks, Leslie. Yes, the including the caregivers and families and their dignity in the work that they do. It's really remarkable. The engagement and the love that they show, and providing them with respite and those types of things is hugely dignifying. So I agree. Hey, Steve, I saved you for last. And so bring us in.
All right. So, when I look at this and reflect upon what the others commented, I see it, I'm turning it around a little bit. So I'm going to look at it from a veteran's perspective. And I just think back to when I was on active duty. You didn't go to mental health. You didn't want to go to mental health. It was kind of a forbidden thing. You didn't do it. So at that point, it was trying to demystify mental health, and so you have to lead from the front. I remember when I was a captain, I taught at leadership school, squadron officer school for the Air Force, and General Fogelman at the time was the TRANSCOM commander, and he came out with, because there was a huge increase in suicide post the Gulf War, the first Gulf War. And so he came out with this whole thing, and we had to teach suicide prevention in leadership training at that time. And he had this video about demystifying asking for help. And so he later became the chief of staff, and that spread. So from my vantage point, I look at it as getting the veteran in the door. So it's not about this equality thing. It's from a veteran's perspective, realizing it's okay to ask for help. And I think that resonates in the 3 videos that we saw just before this session. They all talked about getting to that point where they could ask for help.
That's great. Yeah, thank you so much. Looking at it from the veteran's perspective, I think, there's lots of us that can do that. Looking at it from a family member's perspective, there's lots of us that can do that. Looking at it from just someone who cares, and it has a vested interest because that's where their heart and their mind or their career led them. That's all of that is just critically important, very dignifying, and I'm thank each and every one of you. I've heard mental health is a shared challenge for all of us. It's all of our responsibility, meeting people where they're at. Dignity is respect. It's an essential component. Jennifer, Steve, Leslie, Dana, and Marcus, thank you all. Much appreciated.